Welcome to Access Matters, where healthcare IT meets insight. I am your host, Jennifer Crawford. In today's episode, we are joined by Tyler Smith, CEO of Healthdata Movers, and Luka Salamunic from Access for a discussion about healthcare IT SaaS solutions, weighing in on the pros and cons of best-in-breed versus all-in-one solutions. But first, a little about our guests. Tyler Smith serves as the CEO of Healthdata Movers, a Sidious tech company. Tyler co-founded Healthdata Movers and played a central role in building the company's client services and finance and administration functions before becoming CEO in 2021. Under Tyler's leadership, HDM achieved significant growth and industry recognition. Best in Class 2022 and Consulting Magazine's Best Small Firms to Work For in 2025. Culminating in its acquisition by Sidious Tech in 2025. Now operating as a Sidious Tech company, Healthdata Movers continues to expand its impact across healthcare data management, integration, project management, and clinical and business applications. Tyler earned a Bachelor of Arts in Economics and History, magna cum laude, from Vanderbilt University, and his MBA from the Stanford Graduate School of Business. And also joining us is Luka Salamunic, a software operator, entrepreneur, and investor with over a decade of experience across vertical software, healthcare, and finance. He led the acquisition of Trium in 2022 through a traditional search fund and guided its successful sale to Access Information Management in 2024. Today, Luka serves as SVP at Access, where he drives the company's healthcare software go-to-market strategy. Welcome, Tyler and Luka.
Great to be here.
Tyler, before we get into the pros and cons of healthcare IT SaaS solutions, can you define what we mean by best in breed versus all in one in the context of healthcare IT?
Sure. And it's a great way for me to also share a little bit more of my background because I entered the industry in 2010 when Epic and Cerner and the enterprise or all-in-one systems were really taking hold, and we were moving out of a best-in-breed world. And what I mean by that is each different part of the healthcare system, whether we're talking about the front desk or we're talking about different specialties, tended to have their own software that was unique to the function and workflow of their division or department. And those systems were kind of cobbled together through a network of interfaces, integrations, and that was the prevailing wisdom of how to architect technology in a large healthcare system with meaningful use, the High Tech Act, and essentially kind of the birth of where we are right now with healthcare IT, where adoption rates took off. That's when enterprise or all-in-one systems like Epic or Cerner, which could provide all those different departments with the workflows that they needed in one system. So much more, people use the analogy of more like an Apple based approach as opposed to, maybe the Windows days before. So I look at it, best in breed is different applications for each workflow or division or department. All-in-one enterprise is one vendor or system that can encompass all the different areas of a healthcare system. And so I'll end by saying that's why EHR or EMR, whichever one you use, is almost a misnomer, and why people sometimes get confused when you talk about electronic health record, electronic medical record. These systems are so much more than just the medical record. They really are the system, the operating system for the entire healthcare organization.
Luka, as an executive with Access, where does the Fovea EHR archive sit? Is this an all-in-one or a best-in-breed archival solution, and why? And why does this matter to healthcare leaders in terms of data archival?
Thanks, Jennifer. So Fovea is a best-in-breed, and it's for one very important job, which is turning off legacy systems while keeping the data secure, compliant, and useful for years or decades. And for leaders, that matters because archiving isn't really a nice to have. If you get it wrong, you're going to get stuck paying for all the HRs or EMRs forever. And you're going to get exposed legally as well, potentially. So best in breed does avoid both issues. And just to add on that, as I said, I do come from the search fund space. And the thing with search funds is that given that there are small cap acquisitions, you have to go best in breed if you do want to acquire a business that you can run for decades or, many, many years. And one of the things that we realize is that the more niche you get with search fund acquisitions, the better they perform. So it wasn't my intent originally to go through the EHR data archiving space. To be quite honest with you, I didn't even know the data archiving space existed when I was searching for specialty specific EMRs and EHRs. And when I discovered it, I realized that there was no all-in-one vendor that could really take over the space because of how niche the solution was and how acute the pain point was, which is why I believe that in the long run, there's a world where both best in breed and all-in-one can coexist.
From your perspective as a consultant, what are the biggest advantages of best in breed systems?
Innovation in niches, like Luka mentioned, is more likely to occur in best of breed systems at I don't know if it's 100% of the time. It's definitely not 100% of the time, but maybe more than 50%. And so that's where, if, I think we all are probably capitalists here, we believe that there needs to be some level of competition to push even enterprise. And again, you could look at this with like Apple, or you can look at it with Epic. But if there's a somewhat healthy best of breed ecosystem that's at least trying to exist, that will push more innovation. Now, with archival, it's a very, I wouldn't say obvious, but the use case makes a lot of sense, right? Because the top EHR vendors are probably not going to create EHR super, super light, which is essentially what an archival EHR is, because that kind of would conflict with their product roadmap. And so it's going to make sense that like where you want to have the data repository and the lighter cost are going to be in a best of breed archival product. On the flip, what I will say is the myriad of best in breed systems we had before enterprise became, or all in one became the standard, created a lot of mess with interfacing, and data essentially could get lost or not moved around. So while there are benefits to best of breed in certain regards, I am much more of a proponent of all in one when it comes to an enterprise system, because it solves the problem of building all these different integrations and having a team of interface engineers. The perfection is the enemy is probably the argument there, where it's better to have the hospital system on the same lab as the scheduling. It's just going to be more seamless as opposed to having a separate LMS and having to integrate. So while I do like the idea of having best in breed here and there, on a whole, I'm probably more of a proponent of enterprise.
Okay, and so you've shared, additionally some of the challenges you've seen organizations face with this solution approach. So, Luca, maybe we could have you weigh in there on some of the challenges you've seen.
Absolutely. And just to add on top of what Tyler said, I have seen other examples where best of breed ends up trumping all in one. I do believe that speed of innovation, which is something that Tyler definitely mentioned, is a very important aspect. And sometimes when you get into highly technical solutions, even with some hardware components, it gets very hard for a all-in-one, despite their size, to compete. So for example, PAC systems like Sectra usually beat broad imaging modules from EHR vendors, including Epic. And things like Nuance for ambient speech also beat generic note-taking tools from probably any EHR out there nowadays. And I believe that those cases will persist. despite the fact that interoperability and just connecting these systems tends to be a high intake, a very big investment, and sometimes even a risk. So there's a multi-billion-dollar industry just to cover the PACS space called vendor neutral archival, which is not the same thing that we do with the FOVHR archive product, which is EHR and EMR data archiving. And that whole space is created for the sole reason to serve PACS as their data repository tool. And it's a multi-billion-dollar industry. And it could be disintermediated, but it cannot, because PACS is the best of breed prevailing source of imaging for hospitals and health systems. In terms of the challenges that I've seen with organizations, I would say that the downside isn't really the tech. I think it's the governance. If you don't manage integration and ownership well, you get like the 12 logo monster, which we all seen. Hospitals with Epic, Salesforce, Workday, rev cycle apps, imaging apps, patient engagement apps, with a lack of like an architectural owner. And I think that coordination underlying that is probably the biggest challenge.
Okay. So, in the spirit of debate, Tyler, on the flip side, what might make an all-in-one solution appealing?
Well, I think, and I do want to say, yeah, there's specialty areas like PACS that Luke is mentioning where 100%, if the enterprise isn't proficient or maybe is, I mean, yeah, there's gonna be times the enterprise software system doesn't even have an offering, or proficiency is an acceptable level, and that is 100% a place where you definitely need best of breed. Um, and I would also agree. Well, I think Luke is kind of restating, yeah, the 12 logo problem. Essentially, like just by adding more systems, you will always add more complexity, and that's always going to make it another risk factor for the data moving across systems, with also like vulnerabilities with cybersecurity. So even though it may just sometimes it's just as simple as that. It's not even that complex of a debate point. It's just one singular system is always going to move data better across its different um, applications than multi-system approach. But like Luca was talking about, like ERP, Epic is developing an ERP, and but right now, Workday is considered probably the best ERP platform. There's other great platforms out there, and so there's a point where do you go with an all-in-one that's developing a application or a whole product suite, or do you stay with the system that's already been winning in the market? And that makes sense to use a Workday Epic combination. Um, and so I don't think that there's much argument there. What I would say though, the other benefit of the all-in-one or the enterprise EHRs is, interoperability is one of those problems that we've been trying to solve in healthcare for a while. Going back to the HIEs, the healthcare information exchanges, and one of the other ways to solve it is to have like, most of the systems, most of the healthcare systems on the same system. Because then there's interoperability across different Epic systems or across different Cerner systems or across different Athena Health systems. So that's another argument in favor of using an all-in-one. If you have a cluster of different best in breeds, then the interoperability across, big, large university system in town A with big, large university system in town B is more complicated than if they're both on, ideally an enterprise system of the same brand, but maybe even not. It's still two enterprise systems talking with each other is going to be easier than best in breed versus talking to a enterprise in another system.
So then what are the trade-offs of an all-in-one solution?
Well, I think the trade-offs are that kind of that acceptable level of usability. There's going to be times where the enterprise has a platform that's maybe not totally, or all-in-one platform that's not totally ready. I mean, if you look at it right now, the ambient, I won't call it wars, but maybe that is the right term. You have a bridge and nuance, Dragon Copilot that have both gotten like rave reviews from customers. There's also ambient, and a couple of other platforms. And now, a lot of the shock to the system, or to the more of the shock to the venture capital community, was Epic announcing they're going to move into, some type of voice technology. And so that creates a little bit of uncertainty for fundraising amongst those best in breed vendors, because they obviously are hoping that the big controller of all the health data and the health system customers doesn't come out with a competing platform. Now, would that have, back to the innovation point, if a bridge and Dragon Copilot hadn't, grabbed so much market share or so much attention, where would voice be on Epic's roadmap? Who knows? It might not have been as close, and that's not something that I'm privy to. But you could speculate that maybe they wouldn't have developed a platform for a while. And so when they develop a platform, then it becomes part of the subscription, or maybe it's a upgrade fee, but it's much easier integrated into the existing all-in-one system, as opposed to having to integrate a third-party system. And so that creates ease of use. So in a way, the healthcare systems are winning, regardless, because of competition.
Luka, what are your thoughts here on the appeal versus the trade-offs of all-in-one solutions?
I think I agree with almost everything that Tyler said. I mean, if I'm a rural community hospital with a 5-person IT shop, I'd seriously consider just an all-in-one approach for EHR plus analytics plus patient portal, hopefully plus, DICOM imaging and everything on top of that. It just ends up being so expensive to try to connect all of those systems and having a team in place that it doesn't really make sense. Now, on the flip side, all-in-one systems can slowly turn into like lock-ins, contractually speaking, and as well as like feature speaking. So, for example, EHR vendors are incredible at EHRs, Epic, Athena, Meditech. But when they stretch into everything, maybe voice recognition and those sort of things, those fringe models can lag. And it's like buying a house where all the furniture is like nailed to the floor. And at the beginning, it's going to be very tidy, but you're going to start losing flexibility. And if at any point in time you want to change something, it might not be even possible, right? So, for example, a large multi-hospital system using their EHR vendors archiving module, because it was already in the contract, if they want to change systems, their archiving solution is tied to the original EHR they're trying to get out of. So how do you do it, right? It becomes impossible. It becomes impossible to negotiate. It becomes impossible to build leverage. It even becomes very hard to take out that data, which might be on a schema that only works for that, legacy EHR that for whatever reason ended up losing market share. And now they're like in a position where they're holding the data ransom, and they're not gonna release it easily, right? And we've seen that in the space. Epic does not have a archiving tool, and chances are that they will never will have one. They are building a document management system, interestingly enough, but that's more active and gets connected to the EMR, go live with recent data, not just with past archival information. But there are other EMRs and EHRs that do have archiving tools, or what they call read-only modes. And the issue is, sure, like you call them, you tell them, hey guys, we're changing systems. And they tell you, hey, you can just put all the data into read-only mode, and we're going to charge 1/4 of the cost, which, arguably could be close to what we end up charging as data archiving vendors. But then 5 years down the road, if you try to get the data out, they're going to charge you $500,000, $1 million, $2 million to get that information. So you end up just diluting and postponing the pain. And I think that's where the real trade-offs are.
Yeah, and I think, as you talk about it, it is a question of like technology cycles. And maybe I'm such a fierce proponent of enterprise because I came in when adoption rates were super low. I think only less than 10% of providers were using an electronic health record, and we'd had a best in breed world for 20 plus years. And you looked at all the other industries and they were all digitized, and healthcare was still using paper. And the idea of using paper or using digital records was kind of looked at as, some folks were willing to retire before they would use a computer. And this is 2010. So the iPhone's already out at this point. And so if you look at the cycle, the data, there was no data standardization. So in order to have mass adoption, you would have to have more of a unified approach, meaning, enterprise probably had to win out to have that kind of ability to get everybody online in the most seamless way, which is going to be with one system as opposed to a bunch of different systems. So all that to say is, I don't know that that's the right approach in the future. If all the data, if we have everything discrete in the system, then and data maybe moves more freely and we have more standards and also regulations around how the data can move, then maybe it does make sense to flip back to a best in breed world. And I think this happens across industries, and you could say it's like a decentralization versus centralized approach. So yeah, the going like looking forward, it could be that there's a tipping point, and maybe that's made possible by everyone being on the grid, all the data being able to be mapped, and then it's much easier to create like a modular approach.
Let's talk about some real world examples now. Tyler, as someone who's worked with healthcare clients decommissioning EHRs or migrating EHR data, can you share some examples where best in breed really shined versus where all in one was more effective?
In terms of moving data, it's much easier for us to move data into one system. Um, Obviously the easiest, well, I'll separate it. There's technical and there's like governance. So we move data from Epic to Epic, which is obviously two all-in-one, instances. And we move data from best in breed to all-in-one. We, not that I know of, have moved from a all-in-one to a best in breed. So I don't best of breed. So I don't think I could speak to that movement. When you're moving from a myriad of systems, it obviously takes like much more of a growth mindset in terms of getting up to scale. Although the the bridges and the interface engineers and the conversion analyst, there's pattern recognition and they figure out how to move it, whether it's from a random dental to a standard ambulatory, and then move that into the all-in-one platform. If you're moving from all-in-one to all-in-one, the challenges are more around the configuration, the systems that are merging together. Why, if one instance is selected over the other instance, like why is that configuration the better one? Are they going to make some concessions? So it's much more like probably the world that Luka came from. It's much more like traditional M&A, like actual integration of workflows and systems versus the technical, like analytical piece of locating and mapping data.
Luca, what's the benefit of Access Fovea EHR, or what makes it stand out in the crowd of archival solutions in healthcare?
Thanks. I mean, that's just a bit self-serving, but I'll go with it. It's a good question, nevertheless. So leaders tell us like three main things. Number one is it actually replaces legacy systems. and it doesn't just store data on a vacuum. The second, clinicians can get old records in seconds with just a few clicks. And number three is that they don't really have to redo archival every time they switch EMRs, EHRs, or systems. And they end up having less amount of sources of truth that they need to lever when they're doing their job as custodians of PHI, as caregivers, so on and so forth.
Let's take a quick check-in with our audience. For those of you in our audience, we would love your feedback on your experiences with best in breed versus all-in-one solutions. What drove your decision and why? Please leave your feedback in the comments or let us know at podcastfeedback@accesscorp.com. All right, Luka, Tyler, let's move on to the future outlook. Tyler, looking ahead, do you see the industry moving more toward one model, or will hybrid approaches dominate?
Yeah, I mean, again, yeah, it's kind of what I started going with the last question. I do believe technology moves in cycles, and I do believe that we have gotten more data mapped or discrete. Well, I not believe, I know. And so all that being said, interoperability is still a challenge. And there's factors that are bigger than just technical. There's rules and regulations, and there's competitive components. So, were you to ask me like from a technical perspective, could we move to a best of breed based on what I was talking about in terms of like, is the data all in a format where, it's more like Epic could be the base layer or Cerner or whichever all-in-one platform could be the base layer, and then you can build applications on top of it, and seamless transfer of data isn't an issue. Like, yes, much more so, well, obviously more so than ever. It's kind of like what the AI today, tomorrow is always better than AI today. But, again, there's much more than just the technical aspect of this. There's the competitive nature. I mean, we are in a pretty collegial industry if you look at it versus other industries, but there are definitely there's defensibility of patient populations or providers that healthcare systems think about, and data sharing and transfer is, part of that. And then how do you solve that? Well, regulation and fee structures are the ways that happen. So I'm not really totally answering your question because it, it really does depend on, forces in the competitive landscape, forces from Washington, much more so than any technology aspect. I truly believe like technology is only going to continue to get better, and the technology won't be the barrier to a shift to one or the other. It's going to be driven by the non-technology factors.
Luka, what do you see for the future?
Almost exactly the same. I think Tyler couldn't have said it better. A lot will be decided in Washington, D.C., fortunately or unfortunately. A good analogy for this is just wealth accumulation. So making money is way easier if you have money than if you don't. And wealth ends up accumulating in non-linear ways. In the same fashion, there's economies of scale on accumulating data, systems, use cases, so on and so forth from the market winners. And unless there's regulation preventing that or facilitating best of breed being able to come in and provide a niche solution that can be added into the tech stack of what a health system is using, from all the pros and cons that we discussed, is going to be very hard for those for those organizations and companies to actually be able to sell in a scalable way their best of breed solutions. So all I'm saying here is that unless the 21st Century Cares Act or there's real application to that regulation from an information blockage standpoint, from how interoperability is going to work across systems, and all of those nuances, is going to be actually very hard for, bootstrapped, venture capital funded, or even private equity funded companies to provide a solution that can compete against the behemoths of the space, which have extremely large R&D teams that are doing really good work, but also equally sized lobbyists who are doing great job at making sure that their business moat is kept intact, if not even improving. And that's ultimately going to drive where we end up in the next short to midterm. And again, in the very long term, there's going to be swings, and you're going to see things being built, getting destroyed, being rebuilt again, and that's just part of typical human life cycles. But on our time frame, I think it's going to be driven by regulation, and second by access to easy access to integrations from a best of breed standpoint, so that they can compete fairly with the big behemoths in the space.
All right, let's close this out with some practical advice from each of you. We'll start with you, Tyler. For healthcare leaders listening, how should they approach this decision?
Well, I think with most decisions that are this important, you need to have obviously your own opinion, but the opinions of others who have thought through it probably just as much as you have is equally, if not more so important. If we're experience sharing, every time we've made a decision strategically at Healthdata Movers, prior to our acquisition, I had a board. I also have an incredible co-founder president. And then we've got, great employees. And so I think the way to approach, how you think about a best in breed versus all in one future is, chatting with your peers, getting their opinions, and then also reading up on everything out there. I mean, his talk is probably the best resource. That's like the Wall Street Journal of our industry. I read that every day. Chime has some great publications that, also talk a lot about the policy component. Obviously, Becker's is a great news source. So I think it's being really up to speed with the media in our specific space, as well as talking with your peers around how they're approaching it. Because ultimately, like the future, healthcare is a small world in a lot of ways. It's a world where a lot of people know each other. And yeah, you may not know every politician, but you probably know, or a lot of the folks making decisions, have networks of CIOs, and then they're interconnected with policymakers, and those are the people that are going to make the decisions. And so it really is a game of having an opinion, but validating that with your professional networks.
Any advice from you before we close?
One of my life mottos is living a life with no regrets. So every single time I need to make a life decision or something that is more structural than, what I'm going to eat for lunch, I end up asking myself, will I regret this on my deathbed, or will I regret not doing this on my deathbed? And based on that, I pretty much decide if I want to do something or not. So using the same type of system or heuristic, I'm going to say, don't really start with features. Just start with regret. So if I get this wrong, where will I regret the most? And in simple terms, I think if regret is innovation and flexibility, I would lean on best in breed. If the regret is operational overhead and almost everything else that Tyler said, I would lean in all in one. And I would say the weighted average of the decisions will be leaning into all in one. I do agree with that. But there will be a portion of it which, on the average, for the majority of the providers in the US, there might be solutions where best in breed is just relatively better.
Excellent. Excellent. Thank you. That's a great place to wrap for this episode of Access Matters. A huge thank you to our guests, Tyler Smith and Luka Salamunic, for joining us today and sharing your perspectives. For those of you listening, if you like today's conversation, it really means a lot if you would give us a thumbs up, subscribe, and leave us a review. And we'd love to know what topics you'd like to hear more about. So please email your suggestions to us at podcastfeedback@accesscorp.com. Access Matters is produced by Mike Faber and executive produced by Megan McCord. Until next time, this is Jennifer Crawford with Access Matters.